Thank you for joining us this afternoon. It's great to be able to sign some important legislation this afternoon, starting with Senate Bill 2775, which proposes that the state of Hawaii apply for a waiver of provisions of the Federal Affordable Care Act that compromises Hawaii's longstanding Prepaid Health Care Act. I think for those of us who have been involved with healthcare in Hawaii, we do know how visionary those in the legislature in 1974 were in passing the Hawaii Prepaid Health Care Act. We have heard many and many times it really does form the basis for why Hawaii enjoys healthcare like we do. For the most part, it supported many nonprofits who were involved in healthcare. I think more importantly, it, in my personal opinion, is a direct reason why people of Hawaii enjoy the longest life expectancy in the country. And it has the lowest uninsured rates in the country. So this Senate Bill 2775 proposes that we apply for a waiver effective July 1st, 2017 of the Affordable Care Act, which would allow us to preserve the best parts of Hawaii Prepaid Health Care Act. I guess the real key part of the waiver is to acknowledge that the Small Business Health Options Program, or SHOP, as the federal government likes to refer to, really is unnecessary in the state because of the Hawaii Prepaid Health Care Act. We do know that most of our businesses are able to provide healthcare through the Prepaid Health Care Act, and therefore the SHOP provision in the Affordable Care Act is really redundant. So we do believe that there are other parts of ACA that we would like to incorporate into our healthcare to provide better services for our community. And that's why we are definitely excited to be here to sign this measure. And with that, I'd like to invite my former colleague, Senator Baker, and Representative Bellotti to say a few comments.
Thanks, Governor. Thanks for signing this measure and for being with us on many of the journeys we've had in the recent past. This is sort of the extension of the state looking at how we can better implement both the Affordable Care Act in Hawaii as well as our own Prepaid Health Care Act. And, you know, under the connector that we have sunsetted, so to speak, we were able to direct enroll, and we didn't have to set up a shop. And so with this, we'll be able to continue that, and I'm hoping that with the help of many of your directors that are here and your administration, we're going to be able to look at going further than just the direct enrollment to give us some flexibility to work out healthcare in our state the way it works best for us and get rid of some of the other requirements that really don't apply to us. So I think this is a really important first step. And I would just note that some of our colleagues, you heard them occasionally on the floor say that we needed to apply for this waiver before now, but this is a testament to the fact that the legislature had to enable, and we couldn't do it until 2017. So you'll make it official now, what we've been saying for a while.
And I would just echo the comments that this measure is really about protecting prepaid healthcare and giving us flexibility as states. I would also like to add that, you know, this state, I think, remains committed to implementing the ACA. So we are following all of the rules and guidelines being provided to us by the federal government. And this is the first opportunity that we as a state can actually apply for this innovation waiver. I'm looking forward to working with the federal government as we continue to implement. We still have a lot of work to do with things such as network adequacy, balanced billing, all of these things that are related to the Affordable Care Act. And so we still have a road to go ahead, but this is certainly in line with the guidelines and the rules and regulations put out by the federal government, and we're implementing it as the state in the best way that we can. So thank you, Governor.
Okay, thank you. And so Senate Bill 2775 becomes Act 13. This year.
Lucky 13.
I know, I was thinking whether we should jump some other bills, but I won't be superstitious about that. Thank you.
The team has been.
Yes.
Oh, yes. Can we get a photo? Do you want?
Sure.
Oh, sure.
Sorry.
With Lucky 13?
Yes.
Absolutely.
Okay,
Okay,
we'll
good chair.
right? Yeah. Right.
Partner license. Of course, we could have had that be. But then Ford would get spooked.
Thank you.
Thank you. Thanks, everybody.